Hey, this is Sal Carceller. I'm a resident of Rhode Island. I live in Portsmouth, and I've been following very closely Rhode Island Department of Health and tracking COVID-19. In particular, I've been paying very close attention to breakthrough cases, hospitalizations, and deaths. And this is the website Rhode Island Department of Health puts out. You're welcome, to go there yourself. What I'm about to show you is all based on facts and numbers and requests I made of the Department of Health. So the particular week of interest for this video is actually not the current week. Currently it's November 1st, but the week of interest is September 18th. And let me just tell you why. On September 21st, there was a hearing, a testimonial hearing from Dr. Scott, who is the head of the Rhode Island Department of Health. And she was briefing some of our elected officials at that hearing. I'm going to play portions of that hearing. And that hearing was held right after the September 18th. And one of the questions that was posed to her was if she knew, we could see here that for this week, of the prior week, that current week, they had 136 hospitalizations. Now this number actually changes, and I don't know why. It was like 128 back then, but now it's 136. So I'm going to trust the current data and say that this data must be correct. It's on their website. So they had 136 hospitalizations. What they don't tell you is how many of these hospitalizations of these patients that were hospitalized had tested positive. Obviously, they all tested positive for COVID, but how many of these were vaccinated versus unvaccinated? And that's really the crux of this video. So what I'm going to do at this point is I'm going to go to that video testimony, and I'm going to let you hear it for yourself because it's really important to hear. And you'll hear one of our elected officials question her exactly on this point. So I'll go ahead and play the video now.
Thank you, Mr. Chairman. I've got two general areas of questioning. Do you want me to take them all at once, or do you want me to yield the floor back for other members before?
Let's do the one so we can get everybody in.
Okay, thank you.
And then we'll come back.
Going back to Representative Messier's question, out of the hospitalizations, because I didn't hear an answer to her question. Her question was, out of those folks that are hospitalized, how many of those are vaccinated, how many of those are unvaccinated? So in my mind, that's a continuation of her question because I don't think that question was actually answered. So do you know the actual numbers, the percentages in terms of hospitalizations and those that have been vaccinated, those that have not been vaccinated?
We absolutely have that data. This is just cases, it's not hospitalizations. But the key is knowing that it evolves over time. So prior to the Delta strain really accelerating in July, the majority of people who were hospitalized were unvaccinated. You may recall CNN.
So I'm going to pause right there for a minute. So she's basically telling in testimony that the majority of the people are unvaccinated. And I want you to pay close attention. I'm just going to rewind for a minute and listen to where she got her source.
So prior to the Delta strain really accelerating in July, the majority of people who were hospitalized were unvaccinated. You may recall CNN had published in the middle of the summer, 99% of people who are hospitalized right now are unvaccinated.
Okay. So she quotes CNN. She's the director of Rhode Island, the director of public health. She has the numbers. Her agency has these numbers. Why would she quote CNN? But she's under oath, and she's telling our representative that 99% of the cases of people that are hospitalized are unvaccinated. Let's keep going.
So that's a critical answer. With the Delta strain, because of its significant transmissibility, instead of one person infecting 1 to 2 people, one person can infect 6, 7, or 8 people. You see an increase in cases across the board, as well as hospitalizations.
I understand. I do. Trust me, I understand it. But it was the simple question that was asked. I understand how you come across. I understand where you're going with this. I understand all of it, and a lot of people do. But where people come into a situation, they start to doubt is it's a simple question. We're just asking a simple question, and if you answer it and we go on with it, then we can move on with the hearing. But it's a simple question. I mean, out of the people that are hospitalized with or for COVID, what percentage have been vaccinated, what percentage haven't? You said 99% for CNN reported 99%. Well, Rhode Islanders would like to know, in Rhode Island, out of those that have been hospitalized, what number have been vaccinated, or percentage, whichever you prefer, have been vaccinated or not been vaccinated?
Dr. Scott, some decorum here. Allow the person who is speaking to finish their chain of thought. We're not going to overtalk anyone in the room. You'll get your questions answered according to fashion. Please understand that. There are a lot of people who want their questions answered, and we owe it to them to finish their chain of thought prior to us butting in and ruining their chain of thought. So please understand that, Representative. Dr. Scott.
Yeah, thank you, Rep, and thank you, Chairman. Rep, in slide 36, it's not hospitalizations, but it's a slide in the appendix that has case rates by vaccination status. I know you're looking for hospitalizations. That's some of the data we've actually been working with Representative Chippendale to get, and I'm happy to forward it to you right after this. It's not in a percentage-wise, but we can make that happen pretty quickly.
I just don't have it in front of me right now, and I'm telling you that with the Delta variant, we have an acceleration of people who are hospitalized. The majority of them are unvaccinated. That's the final answer. The majority of people who are hospitalized are unvaccinated.
Okay. Now, again,
Okay, you can go to this site yourself, and you can listen to the whole testimony. This area of the testimony is around the 50-minute mark. The bottom line here is she's holding her ground, basically telling under oath at a testimony that she has the data, which means she's actually knowledgeable of it, and she's claiming that the majority are unvaccinated. Okay, so we heard it firsthand. So I got to thinking about this 99% number and what she was saying, and I decided to take it upon myself to submit an open records request. Also, you can think of it as a Freedom of Information Act. I submitted this request into the Rhode Island Department of Health back right around this date that this video was cut. It was the next day, so somewhere around the September 21st time frame. I sent it in writing to the Department of Health, and I copied several of our elected officials, the ones that were in particular at this hearing. I never heard back. I just figured it went into a black hole and that was it. Well, I was wrong. 4 weeks later, on October 25th, I got my response, and we're going to actually go look at that response now. Before we look at the response, I want to point your attention again to the September 18th week. That they were testifying immediately after this week. They could not have had any knowledge of these other weeks. We were talking about this particular week of September 18th. We had 136 new hospitalizations. And remember, Dr. Scott stands her ground telling us that 99% of the people that have been hospitalized are not vaccinated. Okay, so now here's the email. The first thing I want you to know, we're going to go through the email, is that I wrote a request to the Department of Health, and the person that wrote me back was an attorney. So it took 4 weeks for an attorney to scrub and for the Department of Health to figure out how to reply to a request I asked. So you can read, I'll leave this up, you can pause, the entire context of the request is right here. You can pause the video and you can read the whole thing for yourself. But my request was very, very simple. For the week of September 18th, I'd like to know the number of those hospital admissions that were not vaccinated. Now, notice that I preference very carefully what not vaccinated means to me as a resident. Where not vaccinated means the individual received no COVID shots ever. That's my criteria for not vaccinated. Okay, and I go on. And I kind of already speculated and knew where they were going to go. Basically, look, I'm not interested in the vaccinated numbers because I have no idea what the agency considers somebody to be vaccinated, and I don't really care. What I wanted was the numbers for people who were not vaccinated. It's clear cut. No vaccinations, no shots. Right? So that's my definition. And I asked, please provide me the number of how many of the hospitalizations were not vaccinated, having received no shots. Okay. And so this is him reiterating, dear Mr. Carceller, so this is Morgan reiterating my request. And then he says, you know, I further stated this, right? In response to your request, I first note that the applicable statute is not a Freedom of Information Act, but a Public Record Act. So that was nice of him to tell me, hey, next time you need to submit one, please do so accordingly, because I called it a Freedom of Information Act. So as an attorney, he's reminding me to use the right wording, and that's fine. So then he says, below you will find the hospitalization data. As of October 7, 2021, right, and from the week that I asked for, from the week of September 9th to September 18th, the public data they're willing to release is as follows. During the week of September 9th through September 18th, 125 Rhode Island residents were admitted to the hospital. Well, first of all, on the website, it wasn't 125, it's 128. And now today, it's not 125 any longer. It happens to be, as I showed you, 136. So I assume that they're having trouble, you know, reconciling all the cases. But I'm going to use today's numbers. So today they say that 136 hospitalizations occurred. Okay. So with or because of COVID-19. So now they say, you know, a hospital admission reports are sometimes delayed. Okay, so that's fine. So that's probably why the count went up. Previous data may be updated, right? So now he answers my question. Of the 125 above referenced individuals, 90 were not fully vaccinated. 90. Now, let's keep, that doesn't sound like 99% to me, but let's keep reading. Based on the information recorded in the Rhode Island Vaccine Registry, RI Cares. Remember I was telling you that I don't care who's vaccinated, I care who's not vaccinated. RI Cares is not a complete data set, all right? And he comes out and tells you straight up. So what they're telling you is that they determine how many people are fully vaccinated by going to RI Cares and validating them. If they can't, so if they know there's a probable case and they can't validate it, then they throw it over the wall and call them unvaccinated. That's problematic. So it says, please note, however, that not all vaccinations of Rhode Island residents are registered in RI Cares. That's exactly right. They're not all registered in RI Cares. Vaccines administered out of state or in a federal facility are not uniformly reported in RI Cares. So now I don't even know what to make of this because I don't know what this means. So if somebody from out of state, one of these 125 people are from out of state and they are fully vaccinated, they're not being counted. And worse, they're being considered not vaccinated. All right? So what we know so far is that they took and found 90 of them were not fully vaccinated and verified. Okay? And so you can read on. You will note the above reference data divides the hospitalizations into two categories, fully vaccinated and not fully vaccinated. And then individuals who are not fully vaccinated include all individuals who have received no COVID. And you can read this. The crux of this is that they don't consider somebody fully vaccinated unless they can find them in the Rhode Island care site and verify. Now, the problem with that, like I said, is if a student attending college in Rhode Island winds up going with COVID and is fully vaccinated, and the school knows they're fully vaccinated, the hospital knows they're fully vaccinated, but Rhode Island won't count them as fully vaccinated. Yet they have COVID and they're in the hospital. That's one example. I don't know what a federal agency is, but I'm going to guess that maybe a veterans home might have administered, that's a federal agency facility probably, and they may have issued COVID vaccines at that facility, and they are not in RI Cares. Furthermore, you can opt out of RI Cares. Any resident of Rhode Island can go to RI Cares and scrub their record because you don't want them to know. So if you happen to be in there marked as fully vaccinated and you don't want Rhode Island to know about it, you can go to RI Cares and opt out. Granted, not many residents do that. Okay, so let's get to the crux of this. What we know is they said 90 of them were not fully vaccinated. A simple calculation, all right, if we go back and we look and we have 136 cases, okay, and you do the math on it, you basically take the the 90 cases and divide it by the 136, you get 66%. Now, again, and we already know that in this 66% that are not vaccinated or not fully vaccinated, I want to call them what it is. 66% of the cases could not be verified in RI cares. That's a better way to say it. So now we know that in this profile of these 66%, there are definitely fully vaccinated people. So at best, the number is 66%. That means 33% are guaranteed to have been fully vaccinated and verified. That does not sound like 99% to me. Be very careful what the Department of Health is telling you, and the elected officials, kudos to them for asking the right questions, but they did not get any answers. This pretty much says everything I wanted to say about their data. I had another video out that shows another problematic area in the Rhode Island Department of Health. The bottom line is they are lying through their teeth. They have the data, they know the data, and they don't want the public to know, and worse yet, they don't want our elected officials to know. And yet our elected officials are making decisions on vaccine mandates based on this false data. Hopefully this helps understand a little bit of the digging that I've done. And if anybody else has any requests, I suggest that, as Mr. Morgan pointed out, the attorney, to go ahead and submit your own requests. Do a Public Records Act, and all I can tell you is it works. And they will reply with the data they have. That concludes the video.